Hi, I'm your host Shalagna. Today we are going to talk about something very, very new and different, which is urinary incontinence and sexual health. And we are going to welcome Dr. Sanjay Pandey again to enlighten us a little about incontinence, intimate health, and sexual health as well. So, hi, Dr. Sanjay. A very warm welcome to you. Thank you so much again, taking out some time for us. So, how have you been?
I've been good. Thank you for hosting me on this wonderful program. Nice to bring about some aspects of health which probably is missed out in the society.
Okay, so my first question to you is in the last episode, we spoke a lot about pelvic health, incontinence. So I want to understand what is the connection between these two and sexual health.
A wonderful question on the episode. So let's look into that. Urinary incontinence per se, more common in women than in men. As such, is not spoken about much by women themselves. Sexual health is also big time taboo. So women suffer from more incontinence than men, more by natural reasons as a result of stress incontinence happening because the pelvic floor weakens up. It weakens, as I said, because of pelvic floor dysfunction per se, weakening of the pelvic floor happening as a result of change in the hormone status, finally to menopause, and by pregnancy or multiple pregnancies. So incontinence as such sadly is common in women. If they are already incontinent and leaking urine, they will not be sexually capable enough in terms of being agreeable to or being a happening woman. They have got their difficulties, they have got their urinary infections, they have got their skin infections happening there. They wear diapers more frequently, and women suffer through this very frequently. More women who suffer from incontinence stay away from sexual activity. So one is the mental issue of not being able to take up this sexual activity. Secondly, the entire area being wet, moist, getting infected, having skin changes makes them quite incapable. So obviously there is a huge amount of connection between good urinary function and good sexual function, including sexual hygiene, which these women cannot just maintain. On the male side, the men have got a different issue altogether. They may have overactive bladder, which women also suffer, where they may have increased frequency, urgency, not able to control urine, and sometimes urge incontinence. The problem here is at the level of the urinary bladder. Compared to women who had the stress incontinence because of the pelvic floor, from which they cannot hold urine, men suffer a different picture altogether if it's an overactive bladder. Their sexual function gradually goes away progressively, again with loss of hormones, loss of changes and testosterone changes happening around, and again the prime of life between 30s to 50s. And if that happens, men find sexuality quite difficult to discuss. They need to see a urologist or an andrologist, and they probably need to address both the subsets together. So men and women suffer differently in the agony that goes through with a combination of urinary incontinence, which making life very difficult on the sexual side.
So, doctor, I want to understand when sexual dysfunction actually occurs, how it impacts intimate relationships and life altogether.
That the intimacy is hugely affected by one or both partners having changes in the pelvis. The commonest change in pelvis is urinary incontinence or living with incontinence and leaking urine around. So I think the intimacy quite goes down. Capability of them performing and probably merging together becomes more difficult for them, and therefore they stay away. It becomes all the more difficult, and therefore each partner find the other very difficult. Unless both of them suffering from incontinence. Ideally, one would suffer more than the other. As I said, women suffer more than men, and therefore there's an aversion, there's an agony, and there's a disgust that we cannot get into the activity because we're so much leaking out. So it impacts hugely, especially young men and women, more so after the first pregnancy. After the first pregnancy, they want to be capable enough, but out here there's that leakage which is completely bothersome.
Okay, and this is mostly after post-pregnancy, or this is also across age groups?
So if you look at urinary incontinence affecting sexual health is what we discussed about, it can happen at any age group. So incontinence is not known only to happen in our geriatric grandmother's age group. It can happen to very young ages also. It's all about pelvic floor going little disorganized and dysfunction. But yes, it happens at all age groups. More so perimenopausal age group, where a woman's hormones brings about a lot of central mental changes. Plus, if incontinence is added upon it, then there's a huge burden mentally. Gone through a sexual life in the past, now not so capable enough. At the same time, perimenopausal changes bringing about changes in the vaginal health and intrauterine health. With all that, incontinence has a huge impact. So I think all age groups could go through a trouble when there is leakage of urine on one side, there could be fecal incontinence, who knows, and then there is a sexuality which is probably just getting impeded as a result of the partnership getting less and less intimate. So I think all age groups go through it. As age changes, all the anatomic changes which happen in the pelvis only progress. I would not say worsen, but progress, and progress towards worsening only. So I think it's time to make hay while sun shines, or making the pelvic floor strong enough, redeeming the incontinence in time, so that you revisit your bedroom better with more confidence, rather than living in agony, living with less of intimacy, and therefore loss of partnership many a times.
Right. And in your experience, what are the psychological changes that you've seen in both in men and women?
A wonderful question. So first psychological changes are silence. There's an electrical silence which happens from one of the partners around. Another partner perhaps is not able to adjust to it, which is a sad story. Because it's all about intimacy in the younger age group or in the early years of life. And suddenly a psychological impact about one's own body. You identify yourself as a different individual altogether, and your basic functions in your body are not great. In that situation, you are not able to partner somebody. It could be a male or a female. And that partnership only from a wafer thin line becomes a war. That means probably difficulty to communicate, incapability of maintaining it only worsens with passing time. And therefore, many a times partners miss out on this aspect of not getting into cure rather than getting into fights. So if a partner, probably a female, has got gross stress incontinence and she's wearing diapers all through 24/7, I think it's important for the male partner and the team together to get to see a urologist and get this incontinence sorted out.
So you said that men suffer less, but is it that they seek help less, or they talk about it little less because they feel shy about what's happening with it?
So men never seek help. That's the first one on that. They will only seek help when forced upon to seek help. Many a times I gather wives take appointments for men saying that this man is unworthy right now in the bed, not capable enough, that intimacy and impact is completely gone. So men seek help out of either a scare, men seek help out of a lot of disgust or whatever they tried. Men seek a very stepladder pattern of treating with Ayurveda, with homeopathy, which probably would not hold water in these kind of progressive changes in sexual dysfunction. Men don't get menstrual periods, so they don't know that there's a change happening in them too. That is called as late onset hypogonadism. That means it is late onset that their hormones gradually go down. Initially it was called as andropause or male menopause. That term has gone away, but men do suffer from it too. The loss of confidence, loss of capability, loss of early morning erections, loss of things which talk about your neurobiology going wrong. But this is again very slow, progressive over years. People who are smokers, people who are diabetic suffer more. So imagine somebody is a chain smoker, somebody is a diabetic uncontrolled, somebody has got pelvic health issues or spinal issues. With all this on one side already adding agony with progressive age to the sexual dysfunction, he may not be a capable male and an active partner to a woman. So in other words, why blame a woman all the time? The other way around is, women suffer from something called as refractory vaginismus. That means the vagina cannot be penetrated. The vagina is going through a deep pelvic spasm. Something where a woman cannot just be penetrated.
That must be very painful.
It is a painful kind of a sexual activity. Forget sexual activity. The examination part, evaluation part itself is very difficult. So these women have otherwise a normal anatomical cavity called the vagina, but it just cannot fulfill the requirement because there's a huge pelvic spasm or spasm in the vaginal wall. This requires empathy. This requires a little bit of psychological help. It requires a partner's participation to help out rather than subject her to difficulties. And then there are step-ladder patterns towards therapy which we take forward to relax the vagina.
Okay, and this can occur across all age groups.
So primary vaginismus is more common in women who have got issues with their body image, who don't know what is menstrual periods, who have not had a sex education, whose mothers may not have given them a confidence about what is menstrual periods, and the growth pattern of a woman and a woman's privacy. So that's primary. Yes, secondary also many women can go through post-pregnancy, post-delivery, post-cesarean section. The vagina can tighten up, can shorten up, pelvic floor can move into spasm.
And is this curable, reversible? How is it?
So I think the society needs to know that all that we have talked today is curable. The urinary incontinence, the sexual dysfunction part, both men and women. It is for us to take it forward to the doctor. The problem is we are scared, we are ashamed, we are worried, we think it's not worthwhile, it can be very expensive, or whom to go to. All these aspects jam a man's and a woman's head when they're already going through a term. So we need to correct the factors, number one, at the same time bring about corrections of the disease process. For example, you have to give up your smoking, you have to control your diabetes, being a male. If you are aging gracefully, the hormone changes are happening. Somebody has to give you a hormone replacement therapy from the late 40s, 50s, so that your neurobiology improves, your morning erections improve, your libido improves, your desire improves, etc. On the women's side, where you look at primarily refractive vaginismus, where you need to look at if it is refractive to various therapies and counseling, there are therapies which we do where we inject botulinum lung toxin and paralyze this vagina so that it doesn't contract erratically. So that's one way of giving her a confidence that this is possible. Other way, the urinary incontinence has to be sorted out. So I think it's all step ladder pattern. Nothing happens in a day. Rome was not built in a day. So we want to look at treating them, but with confidence, and obviously the partners are involved all the time. Awareness has to be created, and when to treat and how fast to treat is something which is probably ingrained in the society, in the taboos that they have, in the kind of religious practices we have. But I think the earlier you do things around, the better you treat for any disease, including cancers, including these which are recognizing, which are quality of life diseases. People postpone health on these aspects for a very long time because it doesn't bother them. They can live without sexual activity for a long time. They can live on diapers for a long time. It's not about bleeding, it's not about cancer, it's not about trauma or injury. So quality of life diseases of the type we have talked about, incontinence, sexual dysfunction, sadly is postponed by society. They can live with it and live without it for a very long time till it becomes hugely bothersome. For example, a partnership going down, diapers are getting so wet, we have bedwetting. Then only they wake up.
Thank you so much, doctor, for discussing these topics, because I think there's a lot of stigma around it. Thank you so much.
Thank you very much.
Stay tuned and keep watching us.